what would be the impetus for any type of payer group to now start utilizing telehealth more is the accessibility.
Welcome to the Business of Healthcare podcast from the Center for Healthcare Leadership and Management. The center is based at the Naveen Jindal School of Management at the University of Texas at Dallas. The show, like the center, brings together business leaders and other forward thinkers to discuss how best to meet the challenges of a rapidly changing, increasingly complex healthcare industry. I'm your host, Dr. Bob Kaiser, Director of the Master's Program in Healthcare Leadership and Management for Professionals.
This is our third special podcast related to the topic of COVID-19. Previously, we discussed with two hospital CEOs their approach to being prepared in advance of a pandemic and how they're currently engaging on a daily basis to manage the resources necessary to be effective in their communities. So today, we want to shift our focus to discuss the adoption and utilization of telehealth. And welcome back Dr. Pardeep Shori, who is a Senior Medical Director for Navi Health and a Regional Consultant for CVS. We had Dr. Shori on the podcast the first week of February, and now we're in the first week of April. A lot has changed. So welcome back, Pardeep.
Good day. Thank you so much for having me on.
Well, telemedicine, it's been in the news. We hear about it all the time, but even more so now. We know that it uses internet quality video. And by the way, we're using a new process for these podcasts because we're all operating remotely. We're not in our standard studio anymore, but we get pretty good quality and we can use a variety of devices, whether you have an iPhone or an Android phone or a Mac or a PC. But Pardeep, has the adoption really rapidly increased with this pandemic that we're in?
Definitely. I think sorry to steal the phrase from our Commander-in-Chief, it has truly been a game changer. I think the restrictions that have been lifted or waivers that have been granted, you're seeing primary care doctors, specialists, those who are in the know, those who have never heard of telehealth are now rapidly deploying it. And it's to, again, mitigate and try to stratify who are the patients who need access now, who are those who need education, and those who can stay at home but get medical care treatment through a audio-video means.
So I can see two different groups learning to adopt this technology, this new method. Obviously, the healthcare providers, like you mentioned, the primary care physicians, the nurses, and also the patients. Having patients actually resort to using something they're not familiar with. Is there a bit of skepticism here from someone who's not familiar with this? And how do you get them over that? Is it the doctor's role to encourage it? How does this get put into action every day?
I think we can look at it in multitudes of ways. One is obviously if in this unfortunate circumstance we're all in as of April 2020 with the pandemic, I think if patients feel that there is an opportunity to get sage advice rather than using Dr. Google, I think they will be more prone to be able to use modalities like smartphones, video, or even simple phone systems. So those are the ones who I think are more adaptable at this time of frame. Now, those who are skeptical, regardless whether it's a pandemic, epidemic or not, I think that goes back to the education from the provider, from any of the assistants, nurses or medical assistants, is to kind of assuage those fears and be transparent. Just like with any art of medicine, you're always very clear what you can and cannot do, what is the scope of service, and what are the limitations. And I think any type of new tool, device, medication, or even in this case, telehealth, getting someone to be comfortable to talk to someone from a faraway distance, which they may not know of or know of prior to all this, is always going to be something that both a patient as well as any healthcare provider always have to overcome. And that goes back, you have to educate and encourage and empower that consumer, patient, or member.
Well, that kind of makes it personal a little bit. So recently, with our healthcare provider, we're with the university, and with our healthcare provider, I went out onto the insurance page for that and noticed that they had a provision for doing telehealth. And I had to sign up for it, which was easy to do. And then it involved me downloading an app for my iPhone. And once I got that all set up, now I'm easily kind of proactively ready to use it if I need to. But not really sure if I would have known about that if it hadn't been promoted to me by the insurance company. I know that you're with CVS, and CVS owns Aetna. And I'm sure is that a driver to get people more comfortable to use this type of technology? And do they give advice on how it should be used?
Yeah, definitely. And, even I'll give you kind of a background information. Telehealth has been in the mainstream for the last several years. And that's been through different payer groups, like you said, Aetna or, United Healthcare Group, who has allowed their members to be able to utilize telehealth for a certain restricted use, certain limitation or scope of service for a certain fee. In terms of educating patients, the good sound practice is you should have something that is a document or a waiver or a disclaimer to say that this is when you should use telehealth, this is when you should not use. And then what are concerns that if you're using telehealth and something happens through the audio video, what should you do? So these are what a lot of, I would call good, credible telehealth vendors who are working on behalf of any payer group or a provider, is that they make that very clear up in front, kind of like when you go to a store. They tell you, some stores will have a sign posted that here are your rights or here's things that we can and can't do. A good telehealth group should do that. And then third, what would be the impetus for any type of payer group to now start utilizing telehealth more is the accessibility through audio, video, or even simply through a phone. There's no more of a restrictive barrier because now it can be for new patients or patients who are established. And then the cost component, because that may be a deterrent for patients who are saying, look, I cannot afford $100, but maybe for $20, $30, or maybe the fee is waived, I'm more susceptible to using telehealth than to get in a car and with the concerns and restrictions about traveling outside of your home during this time period.
Yeah, I'm sure that there's a lot of different things people have to overcome, confidentiality, knowing that information is being utilized correctly. So if there's a video telehealth session, at the end of that session, this may be too technical a question, but is that data stored for other people to look at, or is it secured? How does that actually work?
So with most of the telehealth vendors, and when I use the term vendors just to kind of backtrack, these are people who have set up the audio video system through a website. They're working on behalf of a payer group or a physician or a medical provider. And what they typically do is the audio video is usually not recorded. A lot of that is, it's just, again, storage capacity, but then also it is to make sure that the member or the patient or consumer, when they're using it, that they're not being recorded. That may be one of the first things, like you had brought up, what would dissuade a member, consumer, or a patient to use is, are they worried that if they show a lesion on a very sensitive part of their body, is that going to be now recorded? So a majority of them do not record. What they may record is documentation or notation, but they will be very clear to say, and that's one thing you should always have with anyone who uses telehealth is ask, is this going to be recorded? If it is, do I have access to it? And then who do you allow that access to? Do I have to give you permission if you're recording a video or an audio component or storing photos? Are you going to ask me for permission if you are going to share it with other individuals?
Okay, so when it comes time to have a visit, typically if you had pneumonia or some type of respiratory disease, you might be inclined to go use telehealth because you don't want to wait in a waiting room where there's a lot of other sick people. The situation like this where you've got a highly contagious virus, is that the response? If you have a large population, and right now people are trying to find ways to be tested if they have the right criteria, is this being used as a way to intervene and make people feel better of their status? Do we get a lot of calls now using telehealth specifically for COVID-19 prognosis to see if they might be at that stage where they need to, go see their doctor or or check into a hospital?
Yeah, definitely. What I can see with telehealth is it's kind of a risk stratifier or a triage, so to speak. So you may think of it like buckets. So you may have the patient who is just very curious. They don't trust what's on the internet. They're worried about traveling. And that may be an opportunity for general education from a trusted source. So that means from a physician, a nurse practitioner, or PA. Then you have those who say, well, I have a cough and a cold. Is this COVID-19? Is it not? So you're able to assess them and treat them and give them advice as well as what's going on in their local region in terms of restrictions or self-isolation. The third is when you have a patient who may or may not have the risk factors for COVID, but their symptoms are such that it warrants more of a closer look. And when I say closer look means we need to have someone do hands-on examination. And those are the ones that you probably want to be able, in a telehealth means, see right away. Just like if a patient comes into an ER and there's 5 patients and one has severe chest pain, you're not going to say, well, you came fifth in getting into the office, so guess what? You're going to have to wait your turn. You're going to move them up the line. So that's where telehealth can do is it can risk stratify which patients need to be seen right away, give the advice as needed, but then also educate and empower that consumer, patient, or member to be able to either A, go seek a higher level of care, or B, be able to get medication or treatment advice and then follow up with their PCP or back on the telehealth means.
So Pardeep, you work a lot with primary care physicians. If these are independent physicians or maybe they're in a physician group, are all of them taking these calls directly, or is there a bank of doctors behind the vendor, if you will, that basically screens these telemedicine views? Like if you just call up your ordinary, if I call up my family physician right now, I don't know, he's an older, shrewd in the business, the art of medicine kind of guy. And I think he still uses fax machines to communicate. All right. So as much as I'd like him to maybe use this type of technology, he doesn't. But what's been the general response? Is there a bank of telemedicine doctors sitting there waiting to take the calls? Tell us a little bit more about what to expect in terms of the end user deciding to use, telemedicine.
Yeah. So to kind of give a timestamp or maybe even a timeline for those who's listening, prior to, let's say, January 2020, the majority of telehealth was provided through 2 or 3 major vendors. There was a lot of vendors, probably I think I counted about 10 or 15, but majority or the lion's share of that volume was going through 3 or 4 vendors. And those vendors had contracts with payer groups or employers, and they had, as you would say, kind of a bank of physicians who are licensed in those states, and they were on beck and call. Now, since this has opened up where it's more permissible, the accessibility has improved, as well as there's no cost issues. Maybe some of them, the copays are waived. Now you have not just those vendors who are stepping up their volume, but also you're getting those who are now, as you said, like a primary care doctor or specialist who have the EMR on their patients, but now they have to figure out a means of how to communicate to their patients or their members or the consumers on how they can reach them. And the most classic way could be simply you call your doctor's office, the nurse gets information, and then your doctor is there and they do it over the phone with the EMR open and they go over it with you. Or some have already collaborated with some third-party video consortiums who set up a website and it's a simple video consultation. Or some of them have worked with some of these vendors in some agreement to be able to exclusively see their patients and maybe see other patients in the community as brand new patients.
This episode is brought to you by the Center for Healthcare Leadership and Management, the definitive resource for healthcare management education in North Texas. The center is based in the Naveen Jindal School of Management at the University of Texas at Dallas. It plays a unique role in training the next generation of healthcare leaders to meet local, regional, and national demands. The Jindal School uses its strengths in accounting, administration, finance,
marketing, and information systems to educate highly qualified personnel for healthcare administration and executive leadership positions. The center is home to 7 healthcare leadership and management programs, including undergraduate and graduate programs, as well as executive programs for physicians and working professionals. For more information, visit us online at jindal.utdallas.edu/healthcare.
So we hear a lot about flattening the curve, and I think people finally understand that the capacity and demand, you try to spread that out. I know if you go to a large marathon race and there's a shortage of porta pots there, you have to flatten the curve. I mean, you don't have enough resources to accommodate the crowd. And quite frankly, that's what we're trying to do here. Is telemedicine being used really to help flatten that curve quite a bit?
Yeah, I think if you go back with the current prevailing thought as to how to mitigate or control an epidemic or pandemic as of April 2020 is social distancing and limit activity. Telehealth is a great opportunity. At the beginning of this call, the discussion was, can you be able to win over a patient who was very much used to seeing a doctor, having them examine them and talk to them in their office? And if you have someone who's very concerned about traveling, who has significant medical issues that they don't want to have any exposure in a open environment, this is a great opportunity for telehealth to educate them and to be able to treat them, as well as if they have chronic issues that their primary care doctor is aware of, they can manage that through a telehealth means, or even there's remote patient monitoring that can check their blood pressure, their pulse, and relay back to their doctor. It also is a great opportunity to limit, and I would say the 2 groups that are really the key groups in this pandemic, and that is the invincibles, the Generation X, Generation Z, and then those who are the baby boomers, who this has been in the news, that both of these groups are the ones who have a great impact in this pandemic. You can educate those who are millennials on cough and a cold, what needs to be treated. And then those who are elderly, those who are frail, those who have complex medical issues, you can help them in terms of making a decision. Do they need to actually go to their urgent care, or should they stay at home? Or do they need to wait for several days? And if it's not getting better, reach to their PCP. So it's a great opportunity to, I would call it, load manage the current burden that is on the healthcare system, which is the hospitals and the primary care doctor offices.
I think there's a secondary adoption wave. Today, our children are being educated with virtual classrooms. Business is carrying on with meetings where they're not flying to every opportunity to a conference and to a different city. They're managing to get through. Not saying that it'll ever negate the need to be face-to-face, but I think when you're forced to use something new, there may be a secondary adoption for business later on to say, hey, we used this back in the 2020 pandemic and it worked out pretty good. So let's kind of shift our view and start to utilize it. I think that might be the case in the healthcare world as well, is that even though you might have been reluctant to try something like this, but you found out that it did work quite effectively. So going forward, it might be a good utilization as well. What is the Center for Disease Control? What's their view on the utilization of this technology? Do you have any insights there?
I think they definitely would encourage it, and they would always say with any caution that any symptoms that are severity, and that would be something like a boilerplate comment or statement that any primary care doctor would have even when on their answering machine is, if you're calling and you have severe chest pain or shortness of breath, please call 911. Same thing with telehealth. If it is, you're using telehealth as a reasoning to manage your current severe symptoms, chest pain, shortness of breath, unable to stand or walk, you shouldn't really use telehealth. You should call 911. Outside of that, they would say that they would kind of lean to both the medical society as well as the state and local health, as well as the medical boards, is to use proper judgment. And one of the key things that go on with telehealth is that the guiding principle is standard of care. And that is, what would you normally do with this patient that you would also do if you saw them in person. So if I have someone who has a cough and cold, I may ask them to open their mouth, shine a light in their nose or in their throat. But if I have a patient who has severe chest pain and it's radiating to their back, in a telehealth means, unless I have some peripheral device to monitor their heart or someone physically there to examine them, I would, in a normal, reasonable way, want to put a stethoscope on them. So if I'm doing a telehealth visit and a patient says, I have severe chest pain, I can ask them some questions, but I have to kind of stop myself and say, you know what, if it's that severe, I may need you to come in and have an in-person exam because that is the standard of care. So the overall value with telehealth is it can be done and utilized in so many different means, but the guiding principle should be is what is the standard of care you want to render in that telehealth visit? And you don't want to have any patient, member, or consumer to feel that the care that was provided through telehealth was subservient to the care that could be rendered in an in-person environment.
In the past, there were restrictions on how it could be used. Like, for example, children could not be visited with a telehealth environment. Have some of those restrictions been lifted now because of the situation we're in with COVID-19?
Yeah, definitely. I would say, again, as a timestamp, prior to January 2020, there was a lot of restrictions, or one could say even barriers from the American Telehealth Association, a lot of those stakeholders, where you can only deploy telehealth with a certain selected type of patients, either if they were Medicare, Medicaid, where was their location, who needs to be there as a presenter for that patient on their behalf, which is the physicians or type of care that you can provide to them. And now as of April 2020, and it's still a very fluid situation, now it is open for new patients as well as established patients. There's no age restrictions. You can use video, audio, phone. There are some recommendations on, and they will never say, in terms of CMS or Center of Medicare Services, will never say, we endorse this technology or this vendor. They will give you some reference points, but they will always say, be cautious. How are you doing the visit? Also be mindful of compliance, privacy. Obviously, you don't want to have me as a physician talking to a patient and I have a boatload of people behind me and I'm on a boat. There should be no reason for that. But if I'm in a doctor's office and I have a nurse who comes in and says, hey, Dr. Shori, I have something for you. And I say, excuse me, let me just finish this call. There's some laxity in terms of that, in terms of privacy. And that's why CMS was very generous to say, we're going to allow for a waiver and increase or remove the restrictions for telehealth because this is a pandemic, epidemic, and we need to provide reasonable care to as many people as possible, but keep mindful, as you said, compliance, privacy.
Yeah, I would expect that the encryption and HIPAA guidelines would all be incorporated in these technologies by the vendors. So today we're looking at really reacting. We're reacting to a virus. As we move down the road and just look at chronic conditions, looking to see how telehealth could be used to maybe do a better job on a regular, consistent basis with doctor visits for some chronic conditions. Think about the future. Are these possibilities? Today, if you have an iPhone or an Android and you have the video and the audio connections and things like that, we're starting to see other devices, depending on what kind of television you watch. You might see devices advertised where you can get an EKG off your iPhone. You snap on a little device, or you might be able to, look at your diabetes blood sugar level, or you might be able to look at your oxygen level with devices that might be plugged in. Do you see this going even deeper and deeper, where people are getting more engaged, interacting with their doctor through a teledevice of some type?
Yeah, definitely. If these waivers hold and this becomes now a permanent fixture in terms of care delivery, it goes back to the overall aspect of the triple aim, which is improve the quality, patient population health, improve the accessibility and the experience, and reduce the per capita cost. And then there's a fourth one, quadruple aim, which is improve the overall experience for the provider. And you can see if this is now permissible indefinitely and it becomes a major staple in care delivery, you can see three things happen. You can see more opportunities for touch points for members, patients, consumers to engage their primary care doctor or any medical providers. It gives you opportunity to further manage them regardless of where they are in the world. And three, it helps you to, as you alluded to, really make an impressionable difference on their chronic care issues. And I think that is one that's really critical because outside of this pandemic epidemic, we still have hypertension. We still have diabetes. These are issues that are not going to go away, whether it's hot weather, cold weather, whether it's social distancing or not. These are here to stay, unfortunately. So I could see telehealth being deployed a lot more rapidly and more extensively. And at the end of the day, if it's able to improve the overall care for patients, their expectations, reduce costs per capita, improve the quality outcomes, and physicians and patients, consumers, and members are appreciative of this experience, then it's going to be definitely, as I said, not to overuse the statement, it will be a game changer for healthcare.
These are difficult times. We always look for the silver lining in these situations. And some people say, I'm confined to home. The good news is I get to spend time with my family. I get to brush up on my education. I get to engage more in different areas that I typically wouldn't. But we really appreciate you taking the time, Pardeep, to share with us these insights and how they apply and the things that you're doing with CVS and Aetna and in your practice to help facilitate and deal with this problem that we're faced with every day. So thank you for that. We appreciate it.
Yeah, and I would definitely, for those who are listening, if you want to know the latest and greatest with telehealth, three organizations, American Telemedicine Association, they're on the internet. Alliance of Connected Care is another good resource, and Center of Telehealth and eLaw is also a great source. And then, of course, you can't go wrong with checking the latest and greatest from CMS website. But those three that I mentioned are invaluable. They give a lot of good insights. They give a lot of education for those who are, we would call, the bell-shaped curve, those who are early adapters, those are on the other side of the curve, those who are resistant or recalcitrant to what's going on.
Right.
And really good advice. And I would encourage all those who are listening, as we're in this huge sea of change that's going on, it's always good to double, triple check with your, not just with public health, but your local medical society as well as the state medical board, because a lot of times they do also allow for more permissibility of telehealth that you may not hear about in the local press. I would definitely encourage those who are listening to use those resources.
Very good. Well, we've been listening to Dr. Pardeep Shori. Thank you again for your insights and your servant leadership. And we appreciate you coming back on the Business of Healthcare a second time.
Awesome. Thank you so much. My pleasure.
Thanks for listening to the Business of Healthcare podcast. Join us online at businessofhealthcarepodcast.com to find episode links, notes, and more. Be sure to subscribe to the Business of Healthcare podcast on Apple Podcasts or your favorite podcasting app. To learn more about the Center for Healthcare Leadership and Management, go to jundal.utdallas.edu and then search under the Center and Institutes tab on the navigation menu. Also, we want to hear from you. If you'd like to provide feedback, make suggestions for future guests or show topics, or just want to get in touch with us, email us at healthcarebizpodcast@utdallas.edu. Biz is spelled B-I-Z. And let us know how we're doing. I'm your host, Dr. Bob Kaiser, with the Center for Healthcare Leadership and Management, where we're leading change by changing how we lead.